My name is Dr. Bechara Choucair. I'm the Commissioner of the Chicago Department of Public Health. I appreciate the opportunity to discuss the obesity epidemic with you this afternoon. The challenge of obesity is a much more complicated and complex matter than often acknowledged. Our local data indicates that Chicago's children are overweight at approximately twice the national average before they even enter school, and that children living in certain inner city communities are more likely to be overweight. In an effort to transform this alarming childhood obesity trend, the Chicago Board of Health recently approved the phase-in of changes to its daycare center standards to strengthen its nutrition, physical activity, and screen time requirements. There is a large body of evidence which indicates that early childhood provides the best opportunity to prevent obesity, and we believe the health of young children will be greatly improved by making these simple changes within the daycare center setting. Further, we believe the children of Illinois would greatly benefit from adopting similar policies throughout the state. And before any good policy maker attempts to develop an effective statewide obesity prevention plan, the first step should be to have a clear understanding of the scope of the problem. However, in Illinois, this initial step is problematic because access to real-time health data is extremely limited. The state needs to do a better job of making localized obesity data available on a more timely basis. Although a law permitting obesity-related BMI data to be collected from the Illinois State Board of Education was passed, the rules required to initiate data collection have not yet been promulgated, and therefore access to these rich data continues to be unavailable. The State Emerging Health Information Exchange should also assist in providing local health departments opportunities to strengthen their local health surveillance systems by providing them the ability to better monitor and analyze community-level health indicators. Quicker access to these data would allow local health departments the ability to better monitor and respond to community needs. The Chicago Department of Public Health concurs with President Obama's new Childhood Obesity Task Force model and the promising evidence that any successful intervention must be based on the multi-level social ecological model of obesity prevention. Any governmental approach to curbing the childhood obesity epidemic must utilize policy and environmental strategies in a multidisciplinary and interagency effort, as we have had in place since 2006, when the Chicago Department of Public Health created the Interdepartmental Task Force on Childhood Obesity. The task force began with 4 city agencies and our partner, the Consortium to Lower Obesity in Chicago Children, or CLOC. The task force has now expanded to include 11 city agencies. The mission of the task force is for Chicago's city government to have a significant role in confronting childhood obesity through an unprecedented level of coordination, the strategic provision of services, and the advancement of evidence-based practices and policies to improve nutrition and physical activity. The task force employs a 3-tiered prevention model. 1, a focus on coordinated primary prevention activities that utilize data surveillance, communications, evaluation, training, and policy development activities to more efficiently promote physical activity and healthy nutrition to all Chicago's children. 2, early childhood focused activities which include coordinated early childhood motor skills training and enhanced child care standards. And 3, development of wellness campuses throughout the city of Chicago and community areas at high risk for childhood obesity. In addition to the task force, the department is a founding partner of building a healthier Chicago and various other collaborations. All of the department's collaborations have the same ultimate goal: leverage limited existing resources to create better opportunities for the community to improve their health and well-being through increased physical activity and improved eating habits. And finally, we are realistic and understand that due to the current economy, it's unlikely significant new funding will flow from the state to address obesity prevention. Therefore, we believe during this unprecedented fiscal period, Illinois health leaders must work together to develop a coordinated statewide prevention plan. Several national models are already being employed in other states that warrant exploration by the state of Illinois. Any statewide obesity prevention model must, however, take into consideration the different needs among Illinois communities and not use a one-size-fits-all approach. Given the current youth obesity rates, experts warned that this generation will be the first generation to have a shorter life expectancy than their parents. We believe and hope that through working together, the likelihood of this warning coming to fruition for the state of Illinois' youth will be greatly lessened. Thank you for your time, and I sincerely hope these public hearings will meaningfully contribute to addressing obesity. Thank you.